Now, if a patient presents with a viral infection, viremia, septicemia, with the extremely high fever, remember high fever 103, 104, 107, but they're not showing signs, symptoms of the hemorrhaging, bleeding, capillary beds bursting, things like that, that we talked about with Ebola and yellow fever and not whatnot in a previous lecture. They refer to this as non-hemorrhagic fever diseases. Okay, these can be caused by viruses, bacteria, even protozoa. Okay, brucellosis, cat scratch fever, Rocky Mountain spotted fever. Brucellosis, what we're going to start off with, also known as Malta fever. Um, More often than not, for a long time, was referred to as undulant fever. Some areas it's called Bang's disease. Occasionally you hear them, you know, depending upon where you're at in the world geographically, that's, slightly different names for it. Same thing. We see brucellosis is going to hit livestock pretty hard. Um, Causes placental infections, causes spontaneous abortions in cows. So then you got to keep in mind a lot of these infections, we focus on humans, but we're not the only mammals that can get infected. So brucellosis causes those issues. But in humans, brucella lives in our phagocytic cells, our macrophages, our neutrophils, the cells that, the innate cells that are there that are supposed to be on patrol. Remember, I've made the joke, Pac-Man, wagga, 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 wagga. These are the ones that go and find anything not you and are supposed to eat it, kill it. Brucella loves to live in those cells. It gets into them, it escapes, and it lives inside the cell. One becomes two, four, eight, binary fission. Next thing you know, that macrophage bursts. Out comes a few dozen or a few hundred that spread to the next cells. And it just keeps going and going. As they're spreading cell to cell, hiding out from the immune system inside cells, we'll see that these cells start to get infected and die are going to be in the liver, the spleen, the bone marrow. Okay? Liver, spleen, bone marrow. These are going to be cells that are going to have high levels of innate immune system cells, the white blood cells, the macrophages, the neutrophils. With us, we're going to see the undulant fever is going to be because it's a fluctuating pattern of fever, don't feel good, blah, 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 all the symptoms for a few days, a week or two, then you recover. You're good for a while, then it's back. And then you start to get better and you're good for a while, and then it's back. And it's back and forth. And it's not infection followed by another infection, followed by another. It's the same infection, recovery, um, infection, the same infection represents. It's all the cells that are not, all the bacteria that are not hidden inside immune cells get wiped away. You think your body settles down, and then pop, macrophages burst, out comes more brucella. You get these symptoms of infection again, and it just keeps going back and forth. So you have different brucella species depending upon where you're at geographically, which mammals you're talking about. Brucella melanthius, Brucella abortus, and Brucella sus can cause disease in humans. Brucella abortus we find also hits cattle pretty hard. Brucella suis hits pigs quite hard. The pathogenesis here, this one's going to get through damaged skin or mucous membranes. So if you're around livestock a lot, this is going to be one that's going to be of concern. Again, like I said, once it gets into the bloodstream, either you breathed it in, got some secretion, some blood in your mouth, rubbed in your eyes, the micro droplets, whatever. You've got damaged, abraded skin, which, hell, I worked on a farm for a while. That's gonna happen every day. You get some blood on you. It gets into your blood. Phagocytic cells come to clear out things not you. They phagocytize, pull in the bacteria, and the bacteria escapes the vacuole and is now living in your cell's cytoplasm. There you go. Turns out the up and down fever is due to the lipopolysaccharide. Remember, these are gram-negative cocobacilli. So they're inside your cell. Your body clears out all the endotoxin, all the LPS, and you're feeling good. You're okay. But inside those macrophages, the one bacteria that was phagocytized becomes 2, 4, 8, 12, 16, on and on and on. And then all of a sudden those macrophages start to pop, 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 releasing the bacteria and releasing all the accumulated endotoxins that they were shedding. Those endotoxins, that LPS hits your bloodstream and boom, you've got a mini version of toxic shock all over. Then it gets cleared, and then weeks, months later, boom, more macrophages pop. Same thing again and again and again. There's the undulant fever.